My name is Dr. Zubina Mateen. I'm the Medical Director of Hematology and Oncology at the Holyoke Medical Center. And today we're going to discuss some important features of breast cancer. Some of the facts about breast cancer. So, according to the American Cancer Society, there are about 270,000 women who develop invasive breast cancer annually. We feel that the breast cancer is a disease of women, but actually men can get it too. The risk is lower, about 3,000 men every year. Among the American women, it is the leading cancer site where they develop any malignancy. And it is second leading cause of death in women. So about 42,000 women die each year of breast cancer. So that tells us the magnitude of the problem. About 500 men die of it as well. Some other facts. So as we just saw, that breast cancer is the most common female cancer in the United States. It is the second most common cause of death in general. However, it is the main cause of death in women, the younger women aged 40 to 60-year-olds. The most important risk factor is family history and hormonal factors, and we'll go over these in some detail. As far as screening recommendations are concerned, for average risk patients with breast cancer, with the risk of breast cancer, they do recommend breast self-exams monthly starting at the age of 18, clinical breast exam by a physician starting at the age of 18, mammography starting at the age of 40, and then to continue that annually. Some of the risk factors that have been known to be associated with breast cancer. So some of these risk factors are fixed or not modifiable. Gender is one, although in certain circumstances that can be changed. Age, so increasing age is a risk factor for breast cancer. Some hormonal factors or endocrine factors. Benign breast disease, it has been shown that people who have required breast biopsies, they have an increased risk of breast cancer. Family history is also a major factor, and it is mediated by susceptibility genes, and we'll discuss that further. Ethnicity, so Ashkenazi Jewish population have a much higher risk of developing breast cancer than the general population. Mammographic density, so when we look at a mammogram, the mammogram has different densities. So the breast is composed of connective tissue and some glands, and that appears white on a mammogram. However, fat appears dark. So if there is more white than dark areas in the breast, then that increases the risk of breast cancer. So somebody who has about 75% increased in breast density, their risk of breast cancer goes up to 4 to 5-fold. So that has to be taken into account. Some of the modifiable risk factors, these include taking exogenous hormones. This can be oral contraceptives or hormone replacement therapy. Body mass index, so obesity is a risk factor for breast cancer. And diet, so a nutritious diet would be able to protect against breast cancer. Using alcohol in moderation without any heavy use. Exercise is always important. And again, mammographic density is important, and some of the things as listed above, if we focus on those, then the mammographic density can be improved. As we look at the incidence of breast cancer according to age, we see that younger people don't develop it that frequently. Age 30, the risk is 1 in 210. However, as age increases, the risk goes up, and by the lifetime risk is up to 1 in 8 people. Half of all breast cancers occur in the age above 65. So this just shows that 1 in 8 women will develop breast cancer during their lifetime. Endogenous hormones, these are the estrogen and progesterone that are secreted in our bodies, and they do lead to increased risk of breast cancer. So this is signified by early first period, no pregnancy, or late first pregnancy. These are associated with high estrogen levels. Postmenopausal state is also associated with breast cancer. Some of the risk factors that lower the risk of breast cancer, these include late first period, early first pregnancy, early oophorectomy, meaning taking out the ovaries, prolonged lactation, breastfeeding, that is protective. However, they've noted in certain studies that increased short-term risk is there after each pregnancy, but then that risk goes down to baseline. A word about postmenopausal hormone use. So they in the past, when people were perimenopausal, they had hot flashes, they used to be given hormone replacement therapy. However, according to the nurses' health studies done in Boston, they saw that using hormonal replacement therapy increased the risk of breast cancer, and the risk is higher when we use combination of estrogen and progesterone compared to estrogen alone. The duration of use is important, so less than 2 years is less risky as opposed to more than 5 years. It may also have an interaction with body weight. So if somebody is obese, then they may be at higher risk of developing breast cancer. It can also act with the mammographic density. So people who have dense breasts should try to avoid taking hormonal supplements. It's not clear at this point if it is important for women who underlying have risk factors with family history or pre-malignant lesions. And most of the time when people use hormone replacement therapy, they are at increased risk of estrogen and progesterone positive tumors. So how do we diagnose breast cancer? So currently, breast cancer is diagnosed as a result of an abnormal mammogram. Ultrasound may help to determine and clarify things better. So if somebody has a simple cyst noted on ultrasound, if they aspirate the cyst goes away, then they do not need any further imaging or further biopsies. However, it is noted that up to 20% of lesions are not visible on mammograms, so we still need to focus on breast exams, and sometimes we need to do MRIs of the breast to clarify the situation. So this is a mammogram. On the left side, you see a normal mammogram, and on the right, you can clearly see a lesion, which is white, and it has spiculated borders, more like a starlight picture. This is a diagram of a biopsy, the equipment that we use for that. So the patient lies prone and the breast is hanging down, and then under direct vision with imaging, they're able to use a gun to take the sample. So the benefit is that you can get a single insertion and you can get a large sample to be able to look under the microscope, and you don't need any sutures for this technique. Some of the prognostic factors for breast cancer. So the key important prognostic feature is the lymph node status. If somebody has a positive lymph node, then there is a higher chance of the breast cancer returning. However, for that situation, we can use chemotherapy and other treatment modalities which lowers their risk. Tumor size is important. So the larger the tumor size, the higher risk of recurrence. A histological grade. So as the cells look like under the microscope, if they're more aggressive looking, then the grade is higher, and so the risk of recurrence is higher. Sometimes we use tumor markers like CA 27.29, which help to determine prognosis as well. Some of the predictive factors for breast cancer, these would include hormone receptor status. If somebody's tumor has ER and PR receptors on it, that's a better prognostic group. Age at onset, so somebody younger, the tumor would be more aggressive in that case. Performance status, or how well they are functioning, and that also has an impact on the way they respond to treatment. And we also look at growth factor receptors on the tumor. One of these is called HER2/neu, and we do have antibodies that work against this antigen to treat HER2 positive breast cancer. A word about genetic breast cancer. So most of the time when you have breast cancer, it's of the sporadic variety, but 10% of the women would have a family history of breast cancer, and then it can be associated with genetic leads. The most common abnormalities that are seen in the genes are BRCA1 and BRCA2. However, other genes can also be implicated, and we do have genetic testing available to patients who qualify for that. Surveillance for breast cancer with somebody who has genetic predisposition, the recommendations are to start breast self-exams at the age of 18 and continue monthly. Clinical breast exam by a physician starting at 18 and continuing twice a year. Annual mammograms at the age of 25. And then some people may also need MRI surveillance if the mammogram looks suspicious. So what can we do if somebody has a genetic predisposition? So there are several drugs that are available. Tamoxifen is one of them. Affected BRCA carriers, if they take tamoxifen, it lowers the risk of breast cancer developing in the opposite breast by 50%. Unaffected BRCA carriers, their risk is even lowered further, 62%. They're also studying other agents like aromatase inhibitors for prevention of breast cancer in these patient population. What else can we do to reduce the risk of breast cancer? So healthy diet is important, weight reduction, try not to smoke, avoid excessive alcohol use, exercise regularly, so about 40 minutes of daily physical activity, and follow screening guidelines. Some of the ways that you can reduce the risk of breast cancer include getting enough sleep, and breastfeeding also is protective. Some of the foods that are helpful in lowering the risk of breast cancer, these include soy products, cruciferous vegetables, onions, legumes, fatty fish like salmon, citrus fruits like oranges, and berries and garlic. So as long as we follow these guidelines and take responsibility of our health in our own hands, we can lead a normal and healthy and happy life.